So we've been talking about disease and how a microorganism can achieve that state. So remember that a pathogen to be successful has to be able to gain entry. So there are different routes of transmission. We're not fully done talking about that because there's another slide. But it enters our body through different mechanisms. Being able to attach is really critical. Being able to avoid the immune system is really critical. And then also generating different chemicals or molecules that can affect our body in a way where you can get some physical manifestation, which is what we then perceive as disease. And so when we're describing disease and those physiological changes, we do want to differentiate into two discrete categories. And we frequently talk about signs versus symptoms of a disease, or signs and symptoms of a disease. And so we want to make sure we understand what the meaning of each of those terms is. And so when we talk about the sign of a disease, think of when we see a patient, there are vital signs that can always be taken that are done for a variety of different exams. So you can take temperature, you can take blood pressure, take pulse rate. So signs are defined by something that is an objective, measurable parameter that a clinical provider can achieve or obtain. So they can measure it with different instruments, or they can see it with their eye, but it's something that's very objective that they can somehow observe. We contrast that with a symptom that is going to be subjective, and it's going to rely upon the patient to describe it for you. So things like pain. So how painful something is. If you have a sore throat, if you have a headache, if you have joint pain, that's going to have to be described by the patient. And because people perceive pain in different ways, that's a very subjective sort of presentation of how that disease is manifesting itself. So signs and symptoms, both of them can be important in a diagnosis. I'm not saying one's more important, but we differentiate between them because they have different manifestations that we are interested in. We can also talk about asymptomatic infections or asymptomatic diseases where there may be underlying physiological changes, but the individual can't perceive it. And so when we talk about A, that means without or lacking symptoms. And so this is something that we've seen with the coronavirus recently, that individuals can actually have a microorganism in them, but they have no clinical signs and symptoms of it, but they still could be shedding, in this case, virus. And so we'll see some examples of that later on. There's a slide about carriers, but asymptomatic is another important category of infection and disease. And then we can also talk about something that are classified as syndromes. And so syndromes, as it says here, it's a group of signs and symptoms, so it's kind of collection of different things that together are going to characterize a particular condition. And so one that we've studied in great deal is the syndrome that's known as AIDS, and so that S stands for syndrome. And what that means is there's several kind of check boxes that you have to be ticked before someone can be classified as having AIDS. So this isn't something to memorize, but I'll just list a couple of them pretty quickly. So someone has to be HIV positive, so they have the virus that can cause AIDS being present. So HIV is the virus, so they're HIV positive. And then over time, that virus can cause a deficiency in the immune system. So certain immune cells start to diminish and decrease in abundance in our blood. And so once that has reached a certain level of decreasing, so once it gets below a certain threshold in the blood, that's another box that needs to be checked. And once that immune system is not functioning to a sufficient level, or as it diminishes, individuals are going to start to become more prone to opportunistic infections. And so they can have a variety of infections that typically our immune system can fight off, but if someone reaches that kind of threshold of AIDS, then they start to see specific opportunistic infections much more commonly. So those are a variety of manifestations of disease. So sign versus symptom is something that is really important in our understanding of disease. So just as we saw portals of entry on the front end of this kind of series for a microbe to cause disease, they have to enter our body. For the circle to continue and to infect another individual, there needs to be some way in which the microorganism leaves a patient as well. And so this is going to be dependent on the specific microorganism and the specific disease. But as you might guess, respiratory infections are often going to be leaving in those different secretions. Skin infections can be leaving through the shedding of different skin cells, etc. As we saw with the parasites, many of those parasite eggs are passed out in the feces. So there's different routes of infection through that. So portals of exit are going to be important in explaining kind of the circle of an infection and how we can have these infectious diseases be transmitted from one person to the next. So as we're talking about diseases, there are some commonalities that we can talk about. And so this slide is looking at the stages of infectious diseases. And so this is looking at 5 stages that diseases are going to progress through. Now, before I get into the individual ones, do realize that there's a lot of variation within each disease as to how long each of these individual phases and stages are and what is happening during each phase for a particular disease. But these are kind of the classical stages that any disease can kind of progress through. And so the first phase is known as the incubation period. And so as this name indicates, this is the period of time where a microorganism has entered our body, but there are no signs and symptoms as of yet. So it's a period of time where the microorganism can start to grow within us and incubate. So our body is serving as kind of incubator for microbial growth at that time. So that's the first stage. Second stage is known as the prodromal period. And this is where you start to get some generalized signs and symptoms. So you all have experienced this. If it's a respiratory infection, you can start to feel a little bit different. Your throat starts to feel different. You're getting a little bit of mucus production. And so depending upon where the disease enters, you can start to get that change in feeling. So that's called the prodromal period. The period, obviously, that we're most familiar with is the actual illness stage. And this is where you're going to have the most significant and most severe signs and symptoms of the disease. So if we're talking about flu or cold, that's when you're going to have, the highest fever and the most coughing and stuffiness and et cetera. After the illness, we have a period of decline where your symptoms are starting to get better, but you're still feeling not 100%. And then we transition to what's known as the convalescence period. And so that's the period of time where you no longer have signs and symptoms, so you're kind of at the end of the curve. But we still consider it a stage because depending on the disease, an individual can be infectious at any one of these periods of time. So there are some diseases during the incubation period where there's no signs and symptoms, individuals are infectious. So this is true. We're learning this for COVID, that there are both asymptomatic individuals who never have signs and symptoms of the disease that can be spreading it, but then we also use a term that's called pre-symptomatic. So they're just haven't quite reached the prodromal or an illness, but they still could be shedding virus. And the same is true for infections. As individuals get better, they can still be shedding microorganisms during the decline and even into the convalescence. So it just depends. So not all diseases are infectious at every one of these stages or phases, but realize depending upon the disease, you can get spread across different times. And just to further illustrate that and how each individual disease then has to be looked at on an individual basis, this is just looking at incubation period. And so basically, how long is this duration? And the answer is, well, it depends upon the disease. So it can be relatively fast, like a foodborne staph infection. So if you ingest food that's contaminated by staphylococcus and it's made a specific toxin that's called an enterotoxin, you can get sick relatively quickly. So you eat it, and even that day, you can start feeling the effects. Then we can get onto a viral disease like influenza that has about a day incubation and so on. And so even some of these have considerably long incubation periods. So we talked about the syndrome of AIDS can have an incubation period of 1 to greater than 8 years. And one that's really long, leprosy, can incubate for 10 to even greater than 30 years. So this is not something that you necessarily need to memorize. I'm not asking you to know the incubation period for all these different diseases, but just realize it's just to illustrate that each of these phases is going to be an important characteristic of a given disease. So specific diseases have specific incubation times and prodromal and illness and decline and convalescence, and that's something we can use to describe them. And so you want to understand each of these phases and what they mean, so that as you learn specific diseases, you'll understand, oh, the incubation period on average is 2 to 7 days for coronavirus, but it can be up to 14 days, or something like that. Another important characteristic of infections and disease are these things that are known as reservoirs. So if you think about what we talked about so far, human hosts are a really important piece of the puzzle of how a disease is going from one person to the next. And many pathogens actually aren't well adapted to survive long outside the host. And so if the microbe leaves the body, it has a finite period of time before it finds another human host to actually gain entry to that through one of those portals of entry to be successful and continue that life cycle. That being said, there are microorganisms that rely on these things. They're called reservoirs. And this serves as a source where the microorganism can survive outside a diseased human host, so that another human host could become infected at a later date and time. And so there are 3 major types of reservoirs that we want to look at. So there are animal reservoirs, there are human reservoirs, and the term we're using here are carriers. And so these are going to be so when we use the term carrier, they are not showing signs and symptoms of disease. So I should probably say that better. So no signs, symptoms of disease. And we can categorize carriers in 5, well, probably more than 5, but we're going to talk about 5 on the next slide. So we'll do that momentarily. But first, we just want to say, okay, what are we differentiating here, and why are we using this term reservoir with humans? And so these are humans that can harbor and hold on to the microorganism without showing signs and symptoms of disease. And then there are also what we call non-living reservoirs. So obviously humans and animals are both living, but these, soil, food, and water, are going to be reservoirs that certain microorganisms can survive within. When we talk about animal reservoirs, there's another term, or really there are 2 terms here, zoonotic diseases or zoonoses, that describe a disease that has an animal reservoir. And hopefully you see the connection there. When you see the word zoo, you can think of animals. So zoonoses are diseases that have animal reservoirs. And then that brings us to, how can microorganisms that are living within different animals jump back and come in contact with humans? And so these are different mechanisms of transfer between an animal reservoir and a human. And so it may be that you're coming in direct contact with animals. So if you work on a farm, you're working with animals, so you can come in contact with animals that way. But it may be even domesticated animals that we have in our house, so different house pets, so cats and dogs can harbor different things as well, or their waste products. And so just as we saw, many of those parasites are transmitted in the fecal material. And so if you're not coming in direct contact with the animal, but you can come in contact with its waste. So one example of that is hantavirus, which is transmitted in the fecal matter of different rodents. So you may not be in contact with rodents, but if you're sweeping up in a cabin in the woods or something like that, you can be exposed to airborne particles that are contaminated with fecal material as you're kind of brushing up things. But the consumption of animals, we saw this for many of those parasites, undercooked meat or fish or whatever, But then there are also arthropods, so things like insects or ticks or something like that. So mosquitoes, ticks, lice, those blood-sucking arthropods can be important. They're called vectors in transmission. So let's talk about carriers, and then we'll jump back and talk about zoonoses as well. So these are different categories of human carriers. So we use this term asymptomatic. So again, A means without or lacking symptoms. So these are individuals that don't show signs and symptoms of disease at all. They don't get any physical manifestation of disease, and so they're called asymptomatic carriers. We can also have human carriers that they're still in the incubation phase, so they are going to get sick, but they just haven't got there yet, and they can be shedding microbes. So the term we use here is, again, pre-symptomatic. So both of these we now know play a role in the transmission of coronavirus. And then during that convalescence phase, so you can be free of signs and symptoms, but you still may have actively shedding microorganism as well. So kind of before you have signs and symptoms and after you have signs and symptoms. And then you have something that we can say chronic carriers. So these are individuals, there's a story, you can look it up, but it's a famous story about a carrier of typhoid, a typhoid fever. So she's been known as Typhoid Mary. And so these are individuals who carry microorganisms long-term and may not have signs and symptoms. And then lastly, this one's pretty important in healthcare, these passive carriers. And so these are individuals who are working with individuals who are sick, so they can be harboring these microbes on their person. So whether it's on their gowns or their gloves or whatever the case might be. But if you're moving between different patients, it's really critical that you're using good technique and aseptic technique and sanitization and hand washing and all those things. So it's important that those contaminated items are not being transmitted from one patient to the other. But we call those passive carriers as well. There's a lot of information on this slide, but again, not to memorize, but just to illustrate certain points. So again, what the heck is a zoonosis or zoonotic disease? And so it's just going to be a disease with an animal reservoir. Okay, so that's what we want to know. And then which types of microbes can actually be zoonotic diseases. And if you look, we basically are checking all these different categories. So there's different helminths. So those are those parasitic worms like tapeworms and flukes. The protozoans, different fungi, different bacteria, different viruses. So every category of microbe has some examples of zoonotic diseases. So the answer to this is all categories. If we look at diversity of animal reservoirs, you can see it really spans across a variety of different animal groups. So things that are more commonly come in contact with, like I said, domesticated animals like dogs or cats, but then more agricultural animals like sheep and cattle. But then it gets considerably more widespread. Other mammals like monkeys or rodents or deer or birds and rodents, reptiles, etc. So really there's just a diversity, and we see this with bats that can be harbors and carriers of rabies, but we also know bats to be a really important player in harboring corona viruses. So that's where we've seen all of the novel coronaviruses from SARS-1 to MERS to now SARS coronavirus 2, which is what causes COVID-19, all come originally from bats through different animal reservoirs as well. So animal reservoirs can be pretty diverse. And then again, the mode of transmission, there were 3 that were listed on the previous slide. So it's contact with animal, or its waste. Consumption, so eating the animal or animal products. And then some sort of blood-sucking, I'm just going to use insect, which isn't taxonomically correct. Arthropod is better, but most people know insects. And so depending upon the zoonotic disease, it's going to be one of those three. So ingestion of contaminated things, there's a mosquito bite, and here's a lice and ticks and fleas, and et cetera, et cetera. So just realize that all zoonotic diseases, there's going to be some specific mechanism of how it's going to be transmitted back to humans through one of these three that's listed now on this slide as I wrote out, but also on this previous slide as well. So we've touched upon transmission, but we really want to get specific with this. And this is the conversation that has been popularized by coronavirus. And so we really want to make sure we understand the routes of transmission. So the routes of transmission, we can break it down into three major groups. And so there's contact, there's vehicle, and there's vector. But then for each, there are these subcategories that we can better understand. So contact transmission has three subgroups to it. So I'll put an A, a B, and a C. So direct contact is pretty self-explanatory. These are obviously direct physical interactions between individuals that can lead to the transmission of different microorganisms. And so this is obviously one person contacting another. Indirect contact transmission is going to be shared items. And so there's a term that we use to describe these inanimate objects that can serve as important indirect contact transmission points. So whether those are doorknobs, door handles, if you think about a daycare center, different shared toys that kids can be sharing, etc. So that is, although the people aren't coming in contact with one another, each of them, one person touches something and then that person touches something else or touches that same thing later on. And this is where hand washing is a really important tool in breaking this indirect contact transmission, because if you touch something that somebody has deposited microbes on that are pathogenic, then if the more frequently you wash your hands, you can get rid of those before you're touching all sorts of things. So it's not just about protecting yourself. It does help protect yourself, but also it's going to minimize the spread of microbes onto these fomites where someone else could pick it up. And then the last one here is something that we've heard a lot about for coronavirus. So droplet transmission is going to be when someone coughs or sneezes or even talks, many of these microbes are liberated in large droplets that don't disperse too far. And so you have to be within, we've heard that, the 6 feet radius here, it says 1 meter, but those large droplets are going to fall to the ground pretty quickly within that radius. And so to be affected by droplet transmission, you have to be pretty close to one another. And this is where social distancing and masks can play an important role in reducing the transmission of microorganisms, specifically the coronavirus that we're talking about, because that will help capture some of those large droplets so they don't actually get out into the environment where it's going to expose other people. But then also, if you're social distancing as described by public health professionals, those that may not be captured by the mask should drop to the ground pretty quickly. So obviously the concern is coronavirus airborne? And so that's another term you likely have heard of. And so the difference between droplet and airborne is the ability to remain suspended in smaller particles. And so the data early on, we weren't sure. We knew droplet transmission was an important role in transmission of coronavirus. We're now seeing that there is some airborne transmission of this as well. So during certain, they call them super spreader events, there's case studies that have looked at restaurant transmission and also some choir practice. Those are kind of the two big studies that have demonstrated airborne transmission of this. So it's been transmitted beyond that 6 feet or social distancing recommended distance. So while airborne transmission can occur in this, it's not the primary way based on the studies and the data that have been collected, as opposed to other diseases that we know the pathogen can be suspended for long periods of time and can remain airborne. So when we get to airborne, we're talking about vehicle, because these are you can think of specific ways of delivering the pathogen to us. So if the microorganism is successfully aerosolized and can remain kind of floating in the air for an extended period of time, we now have the air that we breathe that can serve as an important vehicle in transmission. And so one of the more common diseases that we know that can be airborne is measles. And so that one can remain suspended for extended periods of time in the air of somebody who, if someone's is infected and they're in a room, that virus can be suspended for an extended period of time even after that person leaves. Some microorganisms can be in the water or in food, and so those are all vehicle-borne. So airborne, waterborne, foodborne are all subcategories of vehicle transmission. And then the last category of the three is vector. And so when you think of vector, this is going to be an arthropod is a better term because that encompasses all of these different categories. If you use the word insect, that's fine. But depending upon the life cycle of the insect or arthropod, then we can break this down into what we call mechanical versus biological. So I'm going to start with biological first, because if you look at these examples, lice, mites, mosquitoes, ticks, they all feed or reproduce within different animals and also humans. And so because of their biology, they are going to be doing something like biting or scratching or laying eggs or doing something that can be part of the transmission process. And so that's part of the biology of the organism. When we talk about mechanical and we look at these guys, these are kind of these pest insects that we know are present and can be feeding on, decaying meat like flies, but then they also want to come and land on your hamburger during, a picnic or something like that. And the same with cockroaches. So on their bodies, they can be harboring different microorganisms because of what they're doing. But they're not, feeding on you or feeding on, laying eggs on your body or something like that. So it's just that their behavior and allows them to interact with microorganisms in one environment. So like, again, rotting meat or something like that. But then also they can come and be these pest insects where they can potentially be in your kitchen or on your food or something like that where you may ingest them. So those are modes of transmission. So again, three major groups: contact, vehicle, vector, but then subcategories as well that are important to be able to differentiate. You don't have to know which diseases are transmitted by each, but basically this is what you're shooting to understand. So a couple more topics. Most people taking this class are going into healthcare in some way, shape, or form. And so you can be that group of passive carriers. And so transmitting disease in a healthcare facility is something that is of growing concern. And so these are called nosocomial or healthcare associated or healthcare acquired infections. And so this is individuals go to a hospital for one reason, and while they're there, they actually get an infection in the hospital. And this Venn diagram of overlapping circles explains why we see an increase in these infections within healthcare facilities. So obviously, if someone's sick with a nasty microorganism, the place that you go is the hospital. So if you have a really bad lung infection like pneumonia, you go there. If you have a really bad gastrointestinal infection and you're severely dehydrated, you go there. So whatever the case is, by definition, people who are really sick with a specific pathogenic organism are going to go to the hospital. So there is an increased abundance of microorganisms in this hospital or healthcare environment. There's another population of patients that are immunocompromised. They just had surgery, so they have these open wounds. They're undergoing chemotherapy. Whatever the reason, you have a population of patients that can be immunocompromised. Both of those are going to be present in a hospital or healthcare facility, and so that's not going to change. And then, of course, you have those staff that are moving between these different populations and potentially serve as that carrier, that passive carrier between these different groups. And so we see a variety of infections. This is not to memorize, but obviously this just shows different types of infections, from respiratory to surgical sites to urinary and blood, etc. And so there's a variety of known microorganisms that are the cause of healthcare associated infections. And it's something that we really need to be aware of, and as healthcare workers, realize that you're an important part of the equation, and really this is really the only thing that we can regulate. And so it's all about patient care and disinfection and sanitization and hand washing and making sure all the instruments are taken care of and all that stuff. So it's important to keep that in mind when you're providing care to individuals, that you're doing everything you can to minimize the likelihood of these infections. So in terms of talking about diseases, there's also one level of understanding of disease that we want to look at. So this is taking a step back from the patient, and rather than looking at individual patients, we want to look at populations. And so this realm of public health is known as epidemiology. We saw this individual long ago when we studied the history. So his name was John Snow, and he studied cholera in the city of London. And he's considered the father of epidemiology. But epidemiologists are those individuals who are going to be studying diseases at a population level in terms of where they're occurring and when they're occurring. And the goal is obviously to understand how they're transmitted, with then implementing strategies to reduce transmission. So rather than waiting for a bunch of people to get sick and then treating those individual patients, they can study this on a population level and understand about the disease and epidemics, and then try to implement public health practices that are going to help reduce transmission, so that we can reduce the number of people who get sick. And so they use different terms to help describe this. So incidence versus prevalence are two that are important. So new cases are going to be the incidence, and then total cases are going to be the prevalence. And so this is, depending upon the disease, there's obviously some length of time that a disease exists for. And so we can talk about new cases versus total cases. And so if we're talking about HIV and AIDS, if there's been instances where someone is considered HIV free, but it's pretty rare. So if you become HIV positive, you're going to be living with that diagnosis for basically a lifetime. And so we have this total number. So some number of HIV positive individuals in the city, in the state, in the nation. And so again, this is over a given period, over a given time. And so those parameters are an important piece of understanding this. So are we talking about city, state, world? So at what geographic level? But then we can also talk about new cases. So how many new cases of HIV do we have in a given part of the world? And so that tells us how the number is increasing over time. So the total number is increasing, but if we're interested in if new cases are diminishing because we've implemented practices, that's an important thing to know. The total number of cases obviously isn't going to go down for a disease like that. So these terms, again, are often going to be over some unit of time. So new cases this month, this week, whatever. Obviously with coronaviruses, we have daily averages that we're measuring. But again, those are done on all different geographic scales. So you can look at county numbers, you can look at state levels, you can look at country or world numbers as well. So in regards to disease, there's some terms that we've used that we want to make sure we define. So when we talked about fungal diseases, we talked about regions of the world where they are endemic. And so that means it's the normal range of where we find that. So certain diseases like malaria have a certain range because we know the mosquito that transmits it, or if it's West Nile virus, or if it's, as we learned about for valley fever, the coccidioides. Fungus has a certain geographic range. So we can talk about areas of the planet where diseases are endemic. And that's just, we expect a certain number of cases in this geographic area over time. If diseases are more sporadic, that's the term we use. So there's not a pattern because it's not frequent enough to describe it in a repeated pattern over a time. And so the difference between endemic and epidemic is when we start to see an increased number relative to what we expect. So if a disease is indeed endemic, then we have this expectation of what we should see over, a given year or flu season or whatever the case might be. But if we're significantly above that, so as it says, occurs at greater than normal frequency, an epidemic is not, it's not necessarily a high number of cases. So what I mean by that is you don't necessarily have to achieve a high number to say, oh, that's an epidemic. So what an epidemic is defined as is it greater than what we normally expect? And so the next slide, I'll give you an example of how this is. And then we've been using the word pandemic. And so what a pandemic means is that there is an epidemic occurring, but it has spread beyond just one continent. So we have had different pandemics over the last many years. Obviously, the current pandemic is across the globe. We had H1N1, which is influenza, which was classified as a pandemic because it spread as well. But anyways, a pandemic is just a kind of a worldwide, or at least multiple continent-wide epidemic. So this slide is going to look at epidemics, and it reinforces that idea that it's not necessarily a large number. So this is looking at two different diseases over a period of time. So diseases over time. So you can see this timeline here over kind of two years. And for many diseases, we see seasonal variation. So flu is one example. And so the blue line in each case is what we expect based on historical averages. And so these two diseases have differing averages, but you can see that they are indeed seasonal. And then what is superimposed on that are the actual data that we see over the course of these 2 years. And so while this first disease, it doesn't mirror exactly, you can see that it bounces around and hovers really close to that expected line. So nowhere does the actual number of cases significantly deviate from what we expect. And so there are no epidemics of this particular one, even though there's a high number of cases. In this disease example, this is disease B, you can see there are two occurrences where the actual data point is significantly higher than what we expect. So again, because this is higher than what we're expecting, and this is higher than what we expect, we would call that an epidemic of that given disease. And so we've had examples of this. So example, like 40 cases of measles. We have more than that, but that was one that was linked to an exposure at Disneyland. So that's not a big number, but seeing as though we had eradicated measles in the United States for many years, now having 40 cases from one event at Disneyland is a pretty big deal. So just realize what an epidemic is. If we expect 0 cases and now we're getting 40, that's a pretty big change. That's a concern, or whatever the change might be. So it's not the absolute number, but what the number is relative to what we are expecting. So when it comes to public health, detecting diseases and diagnosing diseases is a really important part of surveillance. And so it's not super helpful if doctors and hospitals keep that information to themselves, because we need to, public health providers and professionals need that information to see where there are disease clusters. And so there is what are called nationally notifiable diseases. Again, this is not something to memorize, but realize that if there is a diagnosis of any of these diseases, then this information is kind of passed from a bunch of different individuals. So it's not just the doctor in the hospital that get it, but it's going to be the county public health department gets that information, the state public health department, and the Center for Disease Control. So again, you have these different geographic levels of epidemiology getting this information so it can be studied at those different geographic scales, and then also over a specific timeline, so weekly, monthly, yearly, etc. And this information then is published. So the CDC doesn't just hold on to it. And so if you want to know how many cases of hantavirus there is in Arizona over a given week or month or year, you can look that information up, or choose any of these diseases. You can look up that information. So this is known as the MMWR, and we're going to see this at a later date and time. But that stands for Morbidity and Mortality Weekly Report. And so they publish all of these data so that people can be informed about what's going on in public health. So we obviously are in the middle of a pandemic, and so this is kind of a real life situation where this information can be utilized, and hopefully it illustrates how important these different bits of information about infectious disease are. And so I had this, obviously I kind of use slides from the past, and I had this slide up there, and it had SARS. So this is SARS-1, MERS. This one I just added this year, but novel influenza, and there's some tick-borne illnesses called bourbon virus that was found in Tennessee, so it got a name there. So these are known as emerging diseases. So these are diseases that we haven't seen before. But then we also have diseases that we've known about for an extended period of time, but they're coming back more aggressively. And so we've seen Ebola outbreaks more recently, but we've known about Ebola for, approaching 100 years, not quite that long. And the same with yellow fever and dengue fever and tuberculosis. So all of those are diseases that have been characterized for some time, but we're seeing a resurgence of that. And so these are global issues, because as we have seen, what happens in one part of the world, it doesn't just stay there. So whether we're talking about SARS-1 or MERS or now SARS-CoV-2 or Ebola, these viruses didn't stay in that vicinity because of the possibility of travel makes spread potentially so rapid with these. So having important organizations doing global surveillance and communication between them is critical to help understand and prevent these global epidemics and pandemics from continuing to occur both now and in the future. So we're going to take what we learned from this and apply it to specific bacterial diseases, and so that's what we're going to move on to next. As you might guess, we're going to break them down based upon their gram reactions. So we'll start with gram-positive bacteria, but then we'll move on to gram-negative bacteria as well.